For many women who survive breast cancer, the fear of recurrence never truly fades. Even after the last treatment, a shadow lingers. Will it come back? Every ache or moment of fatigue can trigger panic, a reminder that the battle might not be over. This fear is rooted in reality. Microscopic cancer cells can survive treatment, hiding in places like the bone marrow. These sleeper cells can remain dormant for years, invisible to scans, waiting for a chance to return. Survivors are told to stay vigilant, but medicine has long been stuck in a reactive wait-and-see mode. Only when cancer reappears do we act, leaving survivors in a constant state of anxiety. The emotional toll is immense, and the medical community has been desperate for a way to find and eliminate these hidden threats. We needed a proactive solution to finally close this chapter for survivors. The challenge lies in the nature of dormant cancer cells. Unlike active tumors, these cells stop dividing and slow their metabolism, making them invisible to standard scans and untouchable by chemotherapy. They're like fugitives in hiding, evading both detection and destruction. For years, doctors could only guess at their presence, often discovering them only after a tragic relapse. Traditional treatments miss these cells entirely, leaving a dangerous gap in our defenses. This forced researchers to ask, how do these cells survive, and how can we target them? Scientists learned that sleeper cells use sophisticated survival mechanisms, hijacking normal cellular processes to stay hidden. The hunt shifted from visible tumors to subtle biological signals. The key was to understand and disrupt their survival strategy. Only then could we hope to eliminate them for good. A breakthrough came with the CLEVER trial at the University of Pennsylvania. Researchers aimed to detect and destroy sleeper cells in breast cancer survivors considered cancer-free. They studied 51 women who had completed all treatments and showed no signs of cancer on scans. Using sensitive bone marrow biopsies, they found dormant tumor cells in many of these women. For the first time, the invisible enemy was exposed. This allowed researchers to identify survivors at highest risk of relapse. The next step: find a way to target and eliminate these cells. Instead of inventing new drugs, they repurposed existing FDA-approved medicines known to disrupt the survival pathways of these sleeper cells. It was a bold, efficient approach to a long-standing problem. The CLEVER trial's genius was in targeting the sleeper cells' survival systems. Dormant cells rely on autophagy, cellular recycling, and the mTOR pathway, which controls growth and metabolism. By disrupting these pathways, researchers hoped to pull the plug on the hidden cells. They used existing drugs that block mTOR or inhibit autophagy, some already used for other diseases. Patients with dormant cells received these targeted oral medications, not chemotherapy, but precision strikes. The goal starved the sleeper cells or forced them out of hiding, making them vulnerable. This approach spared healthy cells, minimizing side effects. It was a new, gentler weapon against recurrence. For survivors, it offered hope of finally eradicating the seeds of relapse. The CLEVER trial's results were astonishing. After treatment, 80% of patients with dormant cells showed no trace of them in follow-up biopsies. More importantly, over 90% of those treated with a single drug remained cancer-free after 3 years. For those receiving a combination of 2 drugs, the relapse-free rate was 100%. This multi-pronged attack proved incredibly effective at shutting down sleeper cells. The trial demonstrated that we can detect and neutralize hidden threats before they cause harm. This marks a paradigm shift, from waiting for cancer to return to actively preventing it. Survivors can now hope for true peace of mind. The shadow of recurrence may finally be lifted. The war against breast cancer could truly be over for many. The CLEVER trial is just the beginning. Larger studies, like the ABBY and PALAVI trials, are now underway to confirm these results in hundreds more survivors. If successful, this approach could become standard care, a bone marrow test after treatment, followed by targeted medication if needed. This proactive strategy could end the era of wait and see, replacing fear with confidence. For millions, it means a future where cancer-free truly means free. The journey from discovery to global practice is long, but the path is clear. The promise of a life without the constant fear of recurrence is finally within reach. A new era in breast cancer survivorship is dawning.